you just took a tour of the Baltimore Convention Center Field Hospital, I want to say these guys have done an incredible job from the beginning of this COVID crisis. This is a terrific partnership between the University of Maryland Medical Center and Johns Hopkins, and just wonderful doctors and nurses and medical professionals who are out here saving lives every day. And they started out with the field hospital taking care of COVID patients. They moved into doing testing, which is so critically important, and I think we're close to 7.2 million tests now statewide. And now they've moved in to set up this mass vaccination center here at the Convention Center, which is going to really help us reach the community right here in Baltimore City and get more vaccinations. And I'd just like to thank the guys that who are involved. I don't know if you guys want to say anything to start out, or you want to, why don't you guys say a few words, and then we'd be happy to take some questions.
Well, thank you, Governor. I'm Jim Fickey. I'm the director of the field hospital here, and we've been prepared for everything that's come about COVID in the last 10 months. As the governor has said, we've been started up to care for acute patients, and we've continued that. Now almost 1,000 patients that have come through our walls as an inpatient. And then we as a response to the requests for demonstrations in June, we started walk-in testing. And now I think we're the largest single site, and we've been going since June 17th. And that's a trusted entity within the city of Baltimore. Because of that, we've earned the trust, and we hope to continue that as we started vaccines on Friday this week, and we'll be available for really everybody from Maryland. My partner, co-director Chuck Callahan, also.
Yeah, thank you. It's a privilege to be able to be here. I just want to thank, first off, the governor and the state of Maryland and our two respective institutions, Hopkins and University of Maryland Medical System, for the support. We are part of a really tremendous team, people that have come from the community of Maryland and really across of Maryland to join us in this effort. We stood in front of them last Friday and said, look around, never forget this moment, because this is the beginning of the end of this. This is how we get through it. And everybody paused for a second to remember where they were in that moment when we started vaccinating on Friday, and we hope to ramp up very quickly to provide a vaccine for everyone in the state of Maryland who wants one. And if you don't want one, we hope to convince you that you do. So thank you very much, Governor. Again, thank you for your support.
Thank you. Appreciate your leadership. And again, this is a tremendous partnership between both Hopkins and UMS. And I just got a chance to thank some of the healthcare workers, and actually had a chance to speak to a couple of the people that received the vaccine. I can tell you, I know it's a frustrating process because we don't have enough vaccines yet from the federal government, but we're building an infrastructure that's going to be able to handle every single one that they give us, and we're going to be able to get people vaccinated just as soon as we get more supply. And we have a terrific team of people that are all working to get that done. With that, we'd be happy to take some questions.
Governor,
Yeah.
you just talked about it, the supply. When are we expected to see more, and how many?
That's the million-dollar question that nobody has an answer to. We talk to the Biden administration nearly every day asking that same question. I know that they're working, pressing the two manufacturers and trying to figure out everything they can to increase production. They have promised to do so, but they don't have specific numbers or time frames. But we anticipate, we're very excited about the submission of the third vaccine candidate, which I'll be visiting later this afternoon. Emergent Biosolutions will be manufacturing them right here in Baltimore. The minute that EUA is approved by the federal government, millions more will be delivered, rolling off the shelves to the trucks out of the freezers the next day. That's going to be a big help, and they're working to get more to us. But right now, they deliver a little over 10,000 a day to the state of Maryland, and a couple of days last week we did close to 40,000. So quickly, we've now finished 82% of all first doses. The rest of them are scheduled. That's why people are having problems. Why can't we get scheduled for a vaccine? Well, we're waiting for more vaccines. That's the basic issue.
That 82%, that's first doses that you've received?
First doses are vaccinated in arms, 82% of them. 100% of them have been delivered, deployed to our 2,000 and some different locations. 82% are in arms. The rest of them are scheduled. There's none of them sitting at the state, and there's none, we get new batches in every week from the federal government. That starts on Tuesday. I'm going to let the experts give you a real answer.
So, man, we are doing 400 today. As we ramp up, we're capable of right now with the staffing and the support we have from the government and University of Maryland and University Johns Hopkins Medicine. We have a capacity to do 1,500 a day, and we anticipate if we're with normal hour operations and continuing the testing that we've done, we'll be doing 10,000 a week.